Happy Tuesday. It's me, Myra. It's time for another anatomy lesson. Thanks for popping in. This week we're going to be going over the T-spine. The proper name is thoracic spine. We've covered the C-spine or cervical spine in a previous lesson. Go back and check that out if you haven't already. We have not covered the lumbar spine or L-spine just yet. Check back in a week or two and you'll be able to see that. But tonight we're going to go over the thoracic spine, also known as the T-spine. The C-spine has 7 vertebrae, and you will find that out when you go back to watch the first one, the cervical spine video. But just know that cervical spine has a C for cervical, 1 through 7. Thoracic has 12, so T1 to T12. And the lumbar, L spine, has 5, so L1 through L5. Okay? So, it'll make more sense in just a second, all right? So thoracic spine is the middle section of the spine. It's located between the cervical, your neck, and the lumbar, your back. Hence why I just mentioned those two, so you will know, okay? Extends from the base of the neck down to the bottom of the ribs, okay? You have ribs in the back and ribs in the front, kind of like this on both sides, bilateral. Another term that we have learned in one of our lessons. It's the longest, the thoracic spine, T-spine, is the longest and the most complex region of the entire spine. So your cervical, your thoracic, your lumbar, out of all of those, the thoracic spine, T-spine, is the longest and the most complex. Let's figure out why. It's made of 12 vertebrae. We just went over that, right? And each number, T1 through T12, also corresponds to the nerves in that section. So T1 does something, T2 does something. We're going to go over that in just a couple of more minutes, so hang tight, okay? For example, T1 through T5 nerves affect the muscles, the upper chest, the mid-back, and the abdominal muscles, your muscles around here, okay? The thoracic spine is the only spinal region attached to the rib cage. So your ribs, like I said, you have some in the front, some in the back. They go all the way around, okay? Anterior ribs, posterior ribs, bilateral. So there's anterior ribs on the right and the left. There's posterior ribs in the back, right and left as well. Goes around, okay? So, the spinal canal, the spinal bones for the vertebra attach to the ribs. The ribs attach to the vertebra. We're going to see that in just a second. It is part of the thoracic cage along with the sternum, breastbone, and the ribs like we just discussed, okay? Part of the ribs. The bony structures protect the internal viscera, the organs, such as the heart, the lungs, esophagus, where your food goes to your stomach, and also mobile spinal column segment. It's mobile. It can move, okay? The ribs, however, restrict some movement somewhat. The T-spine, thoracic spine, is also prone to strain and injury for many, many reasons. And I'm just going to go over a few right now. Examples of strain or injury to the thoracic spine can be caused by, and this happens to be one of mine, poor posture. I can't tell you how many times my Aunt Georgie told me when I was a teenager growing up, quit slouching, quit slouching. Myra, sit up straight, sit up straight. You think you're sitting up straight, but you're really not. And I can tell now that most of the time I have poor posture in my thoracic spine. My muscles are weak. I didn't listen as well as I should have to my Aunt Georgie. Okay? So once again, examples are poor posture, compression fractures, muscle injuries, fractured vertebra, herniated discs in your T-spine or your thoracic spine, infection of the spinal cord, fluid or disc, osteoarthritis. If you're over a certain age, you start getting osteoarthritis, rheumatoid arthritis. Arthritis just means inflammation of the joints, any kind of arthritis in your spine, your hands, your wrists, your back, knees, feet, ankles, anywhere you have a joint, you're prone to some type of arthritis. As of now, I have arthritis in my wrists. I have fractured them twice here, once here. And I have arthritis there, I have arthritis in my foot, I have arthritis in a knee. It's just part of it. So if you're in any age at all, you probably have a little arthritis. Some of us that are a little bit older may have more arthritis than some people that are just getting started. You know, they're young, but they're starting to creep up a little bit, okay? So osteoarthritis and spondylitis, okay? Some injuries put pressure on the nerves, which increases the pain and other symptoms. Most common source of pain can be inflammation from an injury, okay, inflammation, or once again, like myself, poor posture. You just don't sit up straight. Your muscles are weak. Your body has grown used to just slouching, your back, that sort of thing. But the most common source of pain in the thoracic spine, T-spine, is inflammation from injury or poor posture. Some examples of treatment are injections, steroid injections. Some people get injections in their neck for pain. Some get injections in their T-spine for pain. Some get them in their lumbar spine for pain. They're epidural steroid injections. Or there's other types of injections called trigger points. That just means instead of going near the spinal column, the doctor will say, okay, do you hurt here? Do you hurt there? And if you do, he'll just give you a straight shot in that area, put the steroid in, and you should be good to go for a while. Those are called trigger point. Point to where it's triggering you. Trigger point injections. Also, more examples of treatments other than steroid injections, therapy, physical therapy, work those joints, work that T-spine, get your muscles straightened and get your muscles stronger so you can stand up straighter. Therapy, ice, heat, stretching. You can do some stretches, get those muscles loosened up and get them tight where they need to be. Also, pain medication, okay? Some examples of nerve damage, in case you have nerve damage through injury, arthritis, anything like that. Pain in the thoracic spine, weakness, T-spine's weak, your arms are weak, tingling in your arms, legs, and your rib cage. Any three things of those, tingling, your weakness, pain, can be coming from nerves in your neck, nerves in your thoracic spine, nerves in your low back, your lumbar spine. And I'm going to show you a photo in just a second, actually several, but I'm going to show you one that will actually pinpoint which nerve root is at what level and what pain it can cause, what damage it can control, also what organs are affected. We'll look over that shortly. So, once again, pain, weakness, tingling in the arms and legs, rib cage are some examples of nerve damage. Also, decreased sensation, okay? You had full sensation or what was normal to you, but now it's starting to go down a little bit. So you're having a less sensation or loss of sensation in the arms, legs, loss of bowel, bladder functions, muscle spasms, weaknesses, change in things like your heart rate, your blood pressure, that sort of thing. And we're going to go over examples of those once again in just a second. So, I have an illustration of nerve roots right here. I'm going to hold it up for just a second, then I'm going to turn it back around and I'm going to read them off. Okay, I'm going to read them off. Let me turn. Right here, you might have to turn your screen. This is what I'm going to be reading. So here's a cervical spine, thoracic spine, and lumbar spine. I'm going to be telling you what the damages are, possible symptoms, that sort of thing, all the way down. Even though we're just doing the thoracic spine today, I'm going to go ahead and do this, tell you the cervical and also the lumbar and sacral. So, let's get started. Spinal nerve function. Every cell of your body has a nerve component. C1. C1's way up here. Nerve root. Remember we said the level corresponds to the nerve root, correct? C1, vertebral level, which means C1, nerve root. Intracranial blood vessels, eyes, lacrimal glands, parotid glands, scalp, base of the skull, neck, muscles, diaphragm. Diaphragm is between your chest and your abdomen, underneath your lungs. When you take a breath in, your diaphragm goes down. When you let your breath out, your diaphragm goes back up. C2 also, eyes, lacrimal gland, parotid, scalp, base of skull, neck, muscles, diaphragm. So C1 to C4. C1 to C4. C4 is right around here in the back. C1, C2, C3, C4 is right around the throat area and on down. So starting at C5, 6, 7, and 8, neck muscles, shoulders, elbows, arms, wrists, hands, fingers, esophagus, heart, lungs, and chest. All of that is between C5, nerve root C5 to C8. Moving on down, T1. T1's right about here at your sternal notch. Something else we've learned about already, sternal notch. These are your collarbones, your clavicles. This is your sternum, your breastbone. We've gone over those before a couple of times. C1's right about here. I'm sorry, T1 is right about here. So T1 nerve root down to T4 nerve root. So T1, T2, T3, and T4 nerve roots. Arms, esophagus, heart, lungs, chest, larynx, voice box, trachea, your windpipe, okay? Moving down, T5 to T10. T5, gallbladder, liver. T6, diaphragm, stomach. T7, pancreas and spleen. T9, kidneys, small intestine. T8, once again, pancreas, spleen, kidney, small intestine. T9, T10, your appendix and your adrenal glands. We have not gone over anything in the abdominal cavity yet. That's forthcoming. But just know that T9, T10, T7, T8, pancreas, spleen, kidneys, small intestine, appendix, adrenals, liver. They're like little hats on your kidneys. We'll go over those in another lesson. We're down to T11. Small intestines, your large intestine, also known as your colon, uterus if you're a female. T12, uterus, colon, buttocks, your butt cheeks, okay? Lumbar, L1, L2, L3, L4, L5. Large intestines, buttocks, groin, reproductive organs, colon or large intestine, thighs, knees, legs, lower legs, and feet. Sacrum. Sacrum lives below your lumbar spine, towards your hip area, okay, your sacrum. Your coccyx, also known as your tailbone, okay? Those are your nerve roots. It just says sacral. There's no like S1, S2, S3. There are segments. They just don't name them as such. Buttocks, reproductive organs, bladder, very important. Prostate gland if you're a male. Legs, ankles, feet, and toes. Those are the nerve roots in your sacrum. What they control: buttocks, reproductive organs, bladder, prostate gland, legs, ankles, feet, and toes. Now, let's go back up and figure out and learn about some positive symptoms of these nerve roots that we just talked about. So, possible symptoms in the C-spine. So, we're talking about C1 to C8. C8, T1, same thing, okay? Headaches, migraine headaches, dizziness, sinus problems, allergies, head colds, fatigue, tiredness, vision problems, runny nose, sore throat, stiff neck, cough, croup, arm pain, hand and finger numbness or tingling. Talked about that earlier. Asthma, those that have asthma. Heart conditions, high blood pressure. Those are in the C1 to C7, C8, T1-ish Possible symptoms, those come from those nerve roots. T-spine. So, T1 to T12. Let's talk about possible symptoms stemming from those nerve roots. T1 to T12. Hand, wrist, finger, numbness or pain. Middle back pain. Congestion. Difficulty breathing. Asthma. High blood pressure. Heart conditions. Bronchitis. Pneumonia. Gallbladder conditions. Jaundice. Has to do with the liver. Liver conditions. Stomach problems. Ulcers. Gastritis. Gastro is stomach. Itis, inflammation. Inflammation of the stomach. Okay. Gastritis. Kidney problems. Those are from T1 to T12 nerve root issues. Could be causing those, okay? L1 to L5. Possible symptoms. We already talked about the large intestines, the buttocks, the groin, reproductive organs, colon, thighs, knees, legs, and feet. What kind of symptoms? Constipation, colitis, itis once again, inflammation of what? The colon, colitis, diarrhea, gas pain, irritable bowel, bladder problems, menstrual problems if you're a female, low back pain, pain or numbness in the legs. Can stem from the L1 to L5 nerve roots. Now we're at the sacrum. Once again, buttocks, reproductive organs, bladder, prostate if you're a male, legs, ankles, feet, and toes. Possible symptoms: constipation, diarrhea, bladder problems, menstrual problems if you're a female, low back pain, or numbness in the legs. Those are the spinal nerve functions, where they're located. Here's entire spine over here. Once again, cervical C1, all the way down in thoracic spine, into the lumbar, sacral. Sacral is here. Just below L5 is S1, all the way down. This curvature right here is your coccyx or your tailbone. Okay? Those are the spinal nerve function. Back to the thoracic spine. There are several parts to the thoracic spine. This is a superior view. Here, you're looking down. That's what it would look like. Sagittal here, the side view. This is the sagittal view. I'm just going to tell you what they are. The parts of the thoracic spine vertebra. You have the body, vertebral foramen. Last week we talked about the foramen, where the cranial nerves go through. The foramen is right here, right there. Vertebral foramen, all your nerve roots, your blood vessels, all that go through. You have different notches. Superior vertebral notch forms the margin of the intervertebral foramen, right here on the sides, right there and right there. The lamina is right here. That's the lamina. Some people, when they have back surgery, they have a herniated disc. They do what's called a laminectomy. Ectomy. Take it out, okay? Ectomy, laminectomy. They take and they remove the lamina. Have it on each side, the lamina, to relieve the pressure of the disc. Okay, this just happens to be a T6 vertebra, superior view looking down. looking down like this, okay? Spinous process lives in the back. Posterior spinous process. These on the side, transverse processes. So you have one posterior spinous process. You have two bilateral transverse processes on each side, okay? You also have a pedicle here, and a superior costal facet. Costal means rib. That's where the ribs attach. We're going to learn about the ribs probably next week. Keep that in mind. That is where the ribs attach to the vertebra. It has to attach. Okay? Now, the side view, the lateral view. We're still at T6. Okay? T6. Okay? You have the body again. So if this is the body looking down this direction, this is the body, this little square body from the side. So you'd have the transverse costal facets again where the ribs attach. You would have a pedicle. You'd have a superior articular processes, superior costal, spinous process again. It's going to go right here, spinous process. You're going to have your transverse processes. You really can't see those really well because we're looking at them from the side. But you'd have a transverse process here, and you'd have another one on the other side because you have two bilateral, one on each side. So this is what the thoracic T6 body would look like. Lateral T6 thoracic vertebral body looks like that. Moving on down. So I've showed you a picture of the spinal nerve function. I've showed you the picture of the vertebral body, what that looks like. So, another illustration. Let me get to those really quick. So as you can see on the nerve function sheet that we just went over from C1 to the sacrum, the illustration of nerve roots, you can see exactly which nerve roots affect certain parts of the body. Now let's just talk about a little bit before we conclude. How can thoracic injuries be repaired? There's several, but it depends on the severity, the nerve roots, that sort of thing. They can be fixed by metal screws, rods can be placed. An instance before we go, scoliosis. Scoliosis is very common, mostly in young girls. If you've ever had someone with scoliosis, known someone, or if you're a scoliosis patient, it's kind of what your spine can look like. We're looking at this from the front. Cervical, thoracic, lumbar, sacrum. We're looking at it like I'm looking at you. Okay? So as you can see, it's curved here and it's curved down here. How can they fix that? Well, here's one way they can fix it. Sagittal view, side view, front view. It's what it looks like on an x-ray, okay? They can put screws in. Every one of those are screws to try to straighten the spine back up. Every one of those are screws, okay? This is different. They measure different degrees. How sclerotic are they? 47 degrees on that one and 48 on that one, on that end. That's how to determine what kind of screws they're going to use. Or they can use rods. We just talked about rods. Let me get this. So they'll start at the neck. That's a front view, a AP view of the neck. And the upper T-spine, thoracic, right there. They start with rods from looks like T1-ish right there. And they move it on down to the lower. So T1 is up here. T1 is up there. All the way down the thoracic spine. All the way down the thoracic spine. Sometimes they go all the way down to the lumbar. Sometimes, not always. So they can put screws in, they can put metal rods in. That's a way that they can try to keep that from getting worse. Try to keep it from causing damage to the nerve roots, which causes pain, obviously, or difficulty walking. Posture is bad, stuff like that. Okay, I just gave you one instance. There are multiple people that have had gunshot wounds to the back, can become paraplegic. The bullet hits the spinal cord, severs the spinal cord. They can't feel their legs anymore. They're paraplegic, they're quadriplegic, all four. Stuff like that. They can go in and try to stabilize, but once you hit the spinal cord, it's very, very difficult to get the feeling back. I'm not saying it never happens, but it's very difficult. Lastly, I just want to show you what a normal thoracic spine MRI, lateral to the side, so we're going right to left or left to right. This is what a normal thoracic MRI, one picture, looks like. As you know, in MRI, we do several pictures, some side to side, some front to back, some head to toe. But I found this just to show you what a normal spinal cord. This is the spinal cord here. This is the vertebral bodies there. We have a little bit of the trachea here. This thing right here, that is your sternum looking from the side. Your breastbone looking from the side. Okay? So you would have your manubrium, the body, and the xiphoid tip would be down here. There. So, I hope you've enjoyed the lesson on the thoracic spine, T-spine. I look forward to your comments, and I look forward to seeing you again next week when we'll cover the other topic. Have a good night. Talk to you soon.